Welcome to Using Technology to Advance Equity and Inclusion, Accessibility Tools for Diverse Learners. Milestones Matter. This series was funded by the Connecticut Office of Early Childhood through the Governor's Education Emergency Relief Fund. This presentation was created by educational consultants from Learn Regional Educational Service Center. In this video, you will learn about the importance of developmental milestones and developmental monitoring and screening. You will learn about resources that will help you track your child's developmental milestones, and you will get tips on what you should do if you're concerned about your child's development. What are developmental milestones? Developmental milestones are how a child plays, learns, speaks, acts, or moves. These milestones are things most children can do by a certain age. All young children need both developmental monitoring and developmental screening to help you and your child's doctor, teachers, and other providers know if your child's development is on track. Developmental monitoring observes how your child grows and changes over time, and whether your child meets the typical developmental milestones in playing, learning, speaking, behaving, and moving. Parents, grandparents, early childhood providers, and other caregivers can participate in developmental monitoring. You can use a brief checklist of milestones to see how your child is developing. If you notice that your child is not meeting milestones, talk with your doctor or nurse about your concerns. When you take your child to a well visit, your doctor or nurse will also do developmental monitoring. The doctor might ask you questions about your child's development, or will talk and play with your child to see if he or she is developing and meeting milestones. Your child care provider can also be a valuable source of information on how your child develops, and they may use a tool. Developmental screening takes a closer look at how your child is developing. Your child will get a brief test, or you will complete a questionnaire about your child. The tools used for developmental and behavioral screenings are formal questionnaires or checklists, like the Ages and Stages questionnaire, to collect information about your child based on research that asks questions about a child's development, including language, movement, thinking, behavior, and emotions. Developmental screenings can be done by a doctor or nurse, but also by other professionals in healthcare, early childhood education, community, or school settings. Developmental screening is more formal than developmental monitoring and normally done less often than developmental monitoring. Your child should be screened if you or your doctor have a concern. However, developmental screening is part of some of the child well visits for all children, even if there's not a known concern. The American Academy of Pediatrics recommends developmental and behavioral screening for all children during regular well child visits at these ages: 9 months, 18 months, and 30 months. In addition, the American Academy of Pediatrics recommends that all children be screened specifically for autism spectrum disorder during regular well child visits at 18 months and 24 months. If your child is at a higher risk of developmental concerns due to preterm birth, low birth weight, environmental risks like lead exposure, or other factors, your healthcare provider may also discuss additional screening. If a child has an existing long-lasting health concern or a diagnosed condition, the child should have developmental monitoring and screening in all areas of development, just like those without special healthcare needs. A brief test using a screening tool does not provide a diagnosis, but it indicates if the child is on the right developmental track or if a specialist should take a closer look. If the screening tool identifies an area of concern, a formal developmental evaluation may be needed. This formal evaluation is a more in-depth look at a child's development, usually done by a trained specialist, such as a developmental pediatrician, child psychologist, speech and language pathologist, occupational therapist, physical therapist, or other specialist. The specialist may observe the child, give the child a structured test, ask the parents or caregivers questions, or ask them to fill out questionnaires. The results of this formal evaluation determines whether a child needs special treatment or early intervention services, or both. Why is developmental monitoring and screening so important? Many children with developmental delays or behavior concerns are not identified as early as possible. As a result, these children must wait to get the help they need to do well in social and educational settings. In the United States, about 1 in 6 children aged 3 to 17 years have one or more developmental disabilities, such as autism, a learning disorder, or attention deficit hyperactivity disorder. In addition, many children have delays in language or other areas that can affect how well they do in school. However, many children with developmental disabilities are not identified until they are in school, by which time significant delays might have occurred and opportunities for treatment might have been missed. Research shows that early intervention treatment services can improve a child's development. Early intervention services can help children from birth through 3 years of age learn important skills. For children ages 3 and older with an identified developmental delay or disability, special education services may be provided. Services can include a variety of options depending on the child's need, such as therapy to help the child talk, move and walk, learn, and interact with others. Child Find programs are provided by each state to evaluate and identify children who need special education services. Early intervention programs can provide services from birth to 3 years of age. Local public school systems can provide the needed services and support for children ages 3 and older. Children can access some services even if they do not attend public school. Although early intervention is extremely important, intervention at any age can be helpful. It's best to get an evaluation early so that any needed interventions can get started. The best person to track your child's development is you. Complete a milestone checklist by using the CDC's free Milestone Tracker app from the App Store or Google Play, or by printing a paper checklist from cdc.gov/milestones. Share your child's milestone checklist and any related information from your child's teachers or other providers with the doctor at every well child visit. The Sparkler app is a great way to check in on and log the development of your child's heart, mind, body, and words. It also has fun ways to learn through playing together. The app is available for free to Connecticut families by going to playsparkler.org/Connecticut. Keeping track of your child's development is crucial, and sharing this information at each doctor's visit can greatly enhance the care they receive. Here's how you can use the Birth to 5 Watch Me Thrive passport to keep everyone informed. Every time your child undergoes a developmental screening, fill out the passport or have your healthcare provider fill it in. This keeps a consistent record of your child's development. Bring this passport along with completed milestone checklists appropriate for your child's age to each doctor's visit. These checklists help provide a clear picture of your child's development. Talk about the outcomes of any developmental screenings with your child's doctor to understand any concerns or areas of progress. Ask your doctor to update your child's health records with the latest screening results to ensure all information is current and accurate. Make sure to share this valuable passport with anyone involved in your child's care or education, such as child care providers and teachers. This ensures everyone is on the same page regarding your child's development. You can download this passport from the link on the screen ensuring you always have access to a tool that supports your child's developmental journey. Concerned about your child's development? Here's how to get help for your child. Acting early on developmental concerns is crucial. As parents and caregivers, you know your child best, and early intervention can make a significant difference in your child's life. What is early intervention? Early intervention refers to services and supports designed for babies and toddlers from birth to 3 years of age who are experiencing developmental delays or disabilities. It includes a variety of therapies, such as speech, physical and occupational therapy, tailored to meet the specific needs of each child and their family. Engaging in early intervention can profoundly influence a child's learning and development, significantly enhancing their ability to acquire new skills and succeed in school and later life. These programs are widely available across every state and territory, ensuring that no matter where you live, support is accessible. Many of these services are offered for free or at a reduced cost, making them accessible to families regardless of financial status. The earlier you seek intervention, the better the outcomes for your child's developmental trajectory and overall quality of life. Early intervention is not just about helping the child, but it's about empowering the entire family unit. By recognizing early signs and taking action, you can pave the way for better developmental outcomes for your child. Remember, help your child, help your family. Act early. Taking the first step in addressing your concerns about your child's development is crucial. Step 1 is to make an appointment with your child's doctor. When scheduling, it's important to communicate clearly with the doctor's staff. Inform them that you have specific concerns about your child's development that you would like to discuss during the visit. This preparation ensures that the doctor is ready to address your concerns thoroughly and can allocate enough time during the appointment to evaluate your child's developmental progress. Early discussions are key to setting the stage for any necessary evaluations or interventions that may help your child. As you prepare for your child's doctor's appointment, taking 2 key steps can help make your visit as effective as possible. First, complete a milestone checklist. Use the CDC's free Milestone Tracker mobile app, or if you prefer something hard copy, the CDC's free printable paper checklist. Alternatively, you can use the Ages and Stages questionnaire available on the Sparkler app. These tools are designed to help you track your child's developmental progress accurately. Next, write down your questions and concerns. It's easy to forget important points during a doctor's visit. Before you go, write down any questions or concerns you have about your child's development. Bring this list with you to ensure that all your concerns are addressed during the appointment. By preparing thoroughly, you ensure that you're ready to discuss everything pertinent with your child's doctor, making the most out of the appointment for the benefit of your child's health and development. During your child's doctor appointment, it's important to make every moment count. Here's how you can ensure a thorough discussion about your child's development. First, show the doctor the completed milestone checklist. If there are missed milestones or other concerns, make sure to point these out. It's also important to discuss any concerns you have, even if your child is meeting their milestones. If you have concerns, ask the doctor for a developmental screening for your child. This step is crucial as it provides the doctor with additional information to assess your child's development more accurately and determine the best ways to support their growth. If it appears your child might need a more detailed evaluation, ask your doctor for a referral to a specialist. If you encounter any issues scheduling an appointment with a specialist, mention this to your doctor to seek assistance. By actively engaging in these steps during the appointment, you help ensure that your child receives the attention and care necessary for their development. Ensuring you fully understand your doctor's advice and next steps is crucial for your child's health and development. Here's how you can make sure that you're on the right track. Before you leave the doctor's office, review the notes you've taken during the appointment. Make sure that all of your questions have been answered to your satisfaction. If there's anything you do not understand, or if you need further explanation on some points, don't hesitate to ask your doctor to go over the information again, possibly in a simpler or different way. After leaving the doctor's, go through your notes once more at home to refresh and ensure you understand the steps you need to take next. Remember that you can always reach out to your doctor's office if any questions arise after the appointment or during your treatment. Many doctors now have online portals that you can send a message through. Taking these steps help ensure that you are well informed and confident in managing your child's health needs efficiently. What if you were told to wait and see, but you feel uneasy about that advice? First, talk with another doctor to get a second opinion. At the same time as you ask the doctor for a referral to a specialist, call your state's public early childhood system to request a free evaluation to find out if your child qualifies for intervention services. This is sometimes called a child find evaluation. You do not need to wait for a doctor's referral or a medical diagnosis to make this call. Where to call for a free evaluation from the state depends on your child's age. If your child is under the age of 3, you can call Connecticut Birth to 3 at 1-800-505-7000. You can also dial 211 if you're calling inside of Connecticut. If you're calling outside of Connecticut, you may dial 1-800-203-1234. If you're hearing impaired, you can dial 711. If your child is age 3 or older, call any local public elementary school, even if your child does not go to school there. Say, I have concerns about my child's development, and I would like to have my child evaluated through the school system for preschool special education services. If the person who answers the phone is unfamiliar with preschool special education, ask to speak with the school or district's special education director.